Pre-driving assessments at Marshfield Clinic Health System. Driving is a task that requires many different cognitive and physical abilities. Sometimes health concerns related to injury or aging can impair one's ability to drive. Marshfield Clinic Health System occupational therapists have developed a pre-driving assessment program which includes a variety of tools. What happens during the driving assessment? An occupational therapist will evaluate 4 areas to determine skills and abilities as they relate to driving. Area 1. Cognition. To assess one's cognition, an occupational therapist will test a number of abilities such as visual attention, task switching, mental flexibility, memory, and overall executive function. When driving, a person uses cognitive skills to remember where they are going, assess dangers or hazards that are encountered around them, plan, prioritize routes, trips, stops, and locations traveling to and from. An occupational therapist tests cognitive skills by using written screening tools. Those scores are then compared to research-based norms. Area 2. Visual skills. To assess visual skills, an occupational therapist will check speed of processing visual information, monitor visual neglect, ability to control eye movements, and meet the Department of Transportation physical eye test requirements. When driving, a person uses visual skills to simply see the environment around them, adjust body and vehicle performance in response to things they see in the environment. For example, stop when a ball rolls into the road or a deer runs in front of a car. An occupational therapist will use a vision machine to assess visual acuity, peripheral vision, depth perception, and more. A tool known as the Pelley-Robson chart is used to assess contrast sensitivity, which is a skill used to see a white car on a snowy day or a deer on a dusky night. Area 3. Physical skills. To assess one's physical skills, an occupational therapist will check a patient's strength and range of motion of neck, trunk, and upper and lower extremities. Look for muscle tone abnormalities, focus on motor sequencing, and endurance. When driving, a person uses physical skills to move the steering wheel, operate the gas and brake pedal, open and close car doors, load and unload items into the car, move and walk from car to destination, and move head or neck to help scan for potential hazards in the environment. Physical skills are assessed by using range of motion, strength testing, and measuring speed to walk between 2 targets. Area 4. Reaction time. To assess one's reaction time, an occupational therapist will have a patient demonstrate speed of movement from accelerator to brake. This skill is a combination of processes from the visual, cognitive, and physical systems. A reaction timer is used to find the average time it takes for the patient to move from the gas to the brake pedal. What happens after the driving assessment? Once the assessment is complete, the occupational therapist will discuss results with the patient and support system if present at the appointment. Discussion will include strengths and deficits, potential impact on ability to drive, as well as potential positive or negative impacts on lifestyle changes or community mobility. The OT will attempt to offer community resources and support information to assist the patient in continuing to drive safely or ceasing driving, all while maintaining the highest level of independence and safe functioning. What happens if my provider decides I should no longer be driving? The final decision on legal permission to drive comes from the Department of Motor Vehicles. Depending on your provider's opinion and the results of the pre-driving assessment, the provider may file paperwork to report an impaired driver or request an on-the-road evaluation through the Department of Motor Vehicles. Please talk to your primary care provider if you believe a pre-driving assessment may be necessary.